All right, everybody, welcome back to the show. Today we are diving deep into a question that's probably on a lot of your minds. Should you get a PSA test to screen for prostate cancer?
Yeah.
And we know
Big one.
it can be confusing
It is.
with so much information out there,
Totally.
conflicting advice.
Absolutely.
So to help us kind of make sense of it all, we're going to be using a case study.
Okay.
Meet Mr. Phillip.
Okay.
Mr. Phillip is a guy who's pretty healthy,
Right.
active, no major health issues.
Right.
But he does have some family history of cancer,
Okay.
and he is wondering
Yeah.
about getting that PSA test.
That makes sense.
Sound familiar to anyone out there?
Probably pretty common.
Now, hold on to your hats,
Yeah.
because here's the thing. Prostate cancer is the second leading cause of cancer death for men in the U.S.
Wow.
But get this, only 1 in 29 men who are diagnosed actually die from it.
That's a big difference.
That's a huge gap.
It is. So
Yeah.
what does this mean for you?
Well, it means that understanding the risks and benefits of screening is absolutely crucial.
It is. It is.
Because as we'll see, early detection doesn't always equal a better outcome.
Yeah, that's really important to keep in mind.
And in Mr. Phillip's case, understanding his individual risk factors is going to be a key part of that decision-making.
Absolutely. So let's talk about some of those risk factors.
Okay, let's get into them.
Yeah.
First up, age.
Big one.
Mr. Phillip, like many men considering this test, is in his early 60s.
Okay.
And guess what? The risk of prostate cancer really starts to climb after age 50, and by 70, it skyrockets.
It really does increase significantly as men get older.
Now, another piece of the puzzle is race.
Okay.
We know African-American men have a higher risk,
Ooh.
both for getting prostate cancer and for dying from it.
That's right.
And it's actually pretty startling. Their incidence rate is significantly higher.
It is.
And sadly so is their mortality rate.
Yes, unfortunately, that's a really important factor to consider.
And last but not least, we have family history. Mr. Phillip's mom had colon cancer.
Mm-hmm.
Now, that's not directly related to prostate cancer, but having a close relative with any type of cancer does increase your risk.
It does. It's like a little red flag that goes up saying, hey, pay attention here.
Right, so we've got a sense of who's more likely to develop this cancer.
Right.
Now, let's talk about how we actually find it.
Okay.
What tools do we have in our arsenal?
So the two main tests used for prostate cancer screening are the digital rectal exam, or DRE,
I'm sure some of you are cringing just hearing that.
and the PSA blood test.
Okay, let's unpack these, starting with the DRE.
All right, so the DRE is a quick physical exam where a doctor checks the prostate gland for any abnormalities. It's fast, but here's the catch. It's not very reliable.
Okay.
It often flags a problem when there isn't one,
Okay.
which can lead to unnecessary anxiety and further testing.
So not exactly the gold standard then.
Right.
What about the PSA test?
Okay, so the PSA test measures the level of prostate-specific antigen in the blood. This protein is produced by the prostate gland, and elevated levels can sometimes indicate cancer.
Well,
But there's always a but, right?
always.
Here's the thing, even a slight rise in PSA doesn't necessarily mean cancer.
Okay.
It could just be inflammation, which is much more common.
So now we're getting into the really important part. How do we weigh those potential benefits of early detection
Yes.
against the potential harms of unnecessary treatment?
And that's where those large-scale studies on PSA screening come in.
Okay.
They found that while screening did lead to more diagnoses, the results on whether it actually saved lives were mixed.
So we've got this complex situation where finding more cancers doesn't necessarily translate to fewer deaths.
Right.
And this is where it gets mind-blowing. Imagine screening 1,400 men to potentially save just one life from prostate cancer.
Yeah, that's a significant number, and it means a lot of men would undergo biopsies and even treatment that they may not have needed.
And those treatments can have lasting side effects.
They can.
So the question becomes, how do we balance those benefits and harms?
Exactly.
And that's what we'll dig into next.
Looking forward to it. Yeah, it's a real dilemma, isn't it?
It is.
And to make things even more complicated, there's no clear consensus among the major health organizations.
So basically, the experts are divided.
Pretty much.
No wonder people are confused.
Yeah.
So let's break down what each group recommends.
Okay, sounds good.
Let's start with the U.S. Preventive Services Task Force.
Okay.
They're pretty cautious, saying there's not enough evidence to recommend for or against routine PSA screening in men younger than 75.
That's right. They're taking a very conservative approach.
So they're sitting on the fence a bit.
You could say that. And for men 75 and older, they actually recommend against screening.
Really?
Yeah, saying the harms likely outweigh any benefits at that point.
Interesting. Okay, so that's one perspective. What about the American Cancer Society?
Sure.
Where do they land on this?
They're a bit more proactive. They recommend that men aged 50 and above with at least 10 years of life expectancy
Okay.
have a conversation with their doctor about PSA screening.
And consider getting tested.
Okay.
And for men at higher risk, like African American men or those with a family history, they suggest starting those conversations even earlier at age 45.
So they're really emphasizing that individual risk factor piece we were talking about earlier.
Exactly. It's all about personalized medicine.
And what about the American Urological Association?
Okay.
They deal with this stuff day in and day out.
They do.
What's their take?
They have the strongest stance in favor of screening,
Okay.
recommending that all men aged 40 and above with a life expectancy of 10 years or more get screened regularly with both a DRE and a PSA test.
Wow, okay.
But even they stress that individualized decisions are key,
Right.
and talking to your doctor is crucial.
So we've got a whole spectrum of opinions here.
We do.
From proceed with caution to screen everyone.
Yeah, it can be tough to navigate.
How are we supposed to make sense of this?
That's where the rubber meets the road, you know?
Yeah.
Remember, these are just guidelines, not hard and fast rules.
Right. The best choice for you depends on your individual circumstances and what you're comfortable with.
All right, let's bring this all back to Mr. Phillip.
Okay.
Remember him, early 60s, family history of cancer, thinking about getting a PSA test.
Yeah.
What would we say to him, knowing what we know now?
Given his age and family history, the most important thing for Mr. Phillip to do is have a frank conversation with his doctor. They can discuss his individual risk factors, help him understand the potential benefits and harms,
Right.
and guide him towards a decision that feels right for him.
So it's all about that shared decision-making process.
Absolutely. It's a partnership between you and your doctor, weighing all the factors and making an informed choice together.
And this is something I think we can all take away from this, whether you're thinking about prostate cancer screening or any other health decision. That open communication with your doctor is key.
Couldn't agree more. And here's another crucial point. Early detection isn't always the be-all and end-all.
Wait, what? Explain that one. I thought catching things early was always better.
It seems logical, right? But not all prostate cancers are created equal.
Oh.
Some are slow growing and may never cause any problems, while others are more aggressive.
So you're saying some men might get diagnosed and treated for a cancer that never would have actually harmed them.
Exactly. And that's why this whole issue is so complex.
Wow.
We need to be able to better differentiate between those aggressive cancers that need treatment and those that don't.
That makes sense.
Yeah.
So where do we go from here? If early detection isn't always the answer, what else should we be focusing on?
That's a great question. We need more research on how to identify those aggressive cancers early on.
Sure.
We also need to develop more effective treatments with fewer side effects for the men who do need treatment.
Makes a lot of sense. And
Yeah.
there's one more piece of this puzzle we haven't really touched on yet, the psychological impact of all this.
Oh, that's a really important point.
Right.
Imagine getting a PSA test and it comes back high.
Yeah.
Even if it turns out to be a false positive, the anxiety and stress can be overwhelming. It's a lot to process.
And then there's the whole biopsy process, if that's recommended,
Right.
which I imagine isn't a picnic.
Not a walk in the park.
Yeah.
So we need to acknowledge that mental and emotional aspect of this too, and make sure people have the support they need throughout the process.
We've covered a lot of ground here.
We have.
What are some key takeaways for our listeners?
First and foremost, remember that this is a personal decision. There's no right or wrong answer for everyone.
And get this, folks, early detection isn't always the magic bullet we think it is.
It's true.
We need to be thinking about more than just finding cancer early.
Absolutely.
We need better ways to identify the aggressive cancers and more effective treatments with fewer side effects.
I agree.
And don't forget the emotional side of things. This is a weighty decision with a lot of potential anxieties and unknowns.
It is.
Make sure you have a doctor you trust and feel comfortable talking to.
Yeah,
That open communication is essential.
definitely.
This has been a really eye-opening deep dive.
It has.
I think we've all learned a lot today. So we've talked about the tests and the risks and, benefits, the expert opinions,
Right.
everything.
All 9 yards.
But here's the thing, even if you decide against PSA screening, there are still things you can do to take control of your prostate health.
Absolutely. It's not all about the test.
So what are some of those things?
It's like, what can you do to be proactive?
Exactly.
Well, the good old advice about a healthy lifestyle still holds true.
Okay.
Eating a balanced diet, Getting regular exercise, maintaining a healthy weight, all of that plays a role.
It's amazing how much those basic things impact our overall health.
It really is. And when it comes to prostate health specifically,
Yeah.
there's some evidence that certain nutrients may have a protective effect.
Oh.
For example, lycopene, which is found in tomatoes,
Oh, yeah?
has shown some promising results in studies.
So maybe an extra helping of pasta sauce is in order.
It certainly can't hurt, but of course it's always best to talk to your doctor before making any major dietary changes.
Always good advice. Are there any foods we should be limiting?
Some studies have suggested a link between a high intake of red meat and processed meats
Okay.
and an increased risk of prostate cancer.
So moderation is key, as with most things in life.
I think that's a great way to sum it up.
All right, so we've learned a ton about prostate cancer screening, the pros, the cons, the different viewpoints.
We have.
But at the end of the day, it really comes down to this. It's a personal decision.
It is. There's no one-size-fits-all answer.
What's right for one man might not be right for another.
Exactly.
And that's why talking to your doctor is so crucial. They can help you weigh the options and make an informed choice that you feel good about.
Absolutely. And remember, even if you decide against screening, there are still things you can do to be proactive about your health.
Right. Focus on those healthy habits, stay informed, and keep the lines of communication open with your doctor.
And don't forget that sense of curiosity.
Oh, yeah.
Keep learning, keep asking questions, and be an active participant in your own health journey.
That's a wrap on our deep dive into prostate cancer screening.
Great discussion.
We hope this episode has given you the knowledge and confidence to make the best decision for you. Until next time.